COVID cases and hospitalizations are continuing to come down in LA County and for most of the country. But experts say don't expect the virus to completely go away. They say we should learn to live with COVID being around. So what does that look like in the future?
Well, joining us now is Dr. Luis Abrashamian. He's an ER doctor at Providence Little Company of Mary Medical Center in Torrance. Welcome, doctor.
Thanks for having me, Amy and Juan.
Well, it's now 2 years into the pandemic. We have vaccines, new medicines, and natural immunity from those who've recovered from COVID. And given all that, what does living with COVID look like in the months and years to come?
It's a great question. Every time we let our guard down, there seems to be another wave. So I think the big thing is managing your personal and your loved one's risk. The things you can do are, obviously getting vaccinated and being aware of your surroundings, but also understanding that as we get more data about COVID and the mortality, that it's something that may or may not continue to be with us, but exercising hand hygiene and normal common sense methods can be quite helpful moving forward.
Doctor, I'm curious, a lot of people talk about having long COVID. What exactly does that mean? And if you had COVID 2 years ago, some people may be, thinking that what's happening to them now is associated to that. So what is it exactly, long COVID?
Long COVID, great question. Truly in the ER and in primary care settings right now, we are hearing cases of long COVID per se, but you're not going to like my answer, but it's not necessarily time to necessarily opine on whether or not long COVID's a real entity. We are seeing people with long-term anosmia or changes in their smell. But as far as COVID with long-term sequelae, if it is going to be an entity, I think it will end up being quite rare.
Well, California has lifted its indoor mask mandates, and LA County is about to do the same. So should some people still wear a mask indoors?
Sure, that's a great question. And it really goes back to managing your own and your loved one's risk. So if you look at the infection fatality rate for COVID, this great Lancet article just came out in the end of February. You're looking at 7-year-olds, 30-year-olds, 60 and 90-year-olds with mortality rates of 0.002% for the youngest, 30-year-olds with a 0.005%, 60-year-olds with a 1% risk of death, and 90-year-olds with a 20% chance of getting of passing away from COVID, sorry. So, and this is pre-vaccine data. This is from April 2020 to January 1st, 2021. So those numbers are down now with the vaccination numbers that we have. But those don't take into account things like, whether or not you're in a nursing home, if you have comorbidities like chronic lung disease, diabetes, obesity, and where you are in the world and access to hospital care. And so it's all about, if you're young and you're healthy and you're vaccinated, your risk profile looks a lot different than if you're older or if you're a caregiver for somebody who's older or at risk. So it's all about speaking with your doctor and really being aware of your own management and risk profile.
Doctor, let's talk about vaccinations. Do you think we'll be having to get these yearly boosters for COVID, given that the virus continues to mutate?
Another great question. I just got my booster this past Friday personally after having COVID over Christmas. And I think that there's a good chance that nobody knows for sure. In Israel and other countries, they're on their 4th vaccine dose. Personally, I sure hope that doesn't end up being the case, but I think especially as a healthcare worker, we're held to a little bit different standard and we want to be safe for the public. And so, if this ends up being a cyclical virus, sure, you get your yearly booster like you do with influenza. But remember SARS in 2003 kind of fizzled out and it ended up not being a coronavirus that we ended up needing cyclical vaccines for. So let's hope for the latter.
I agree with you. Dr. Luis Abrashamian, thank you so much for joining us today and providing some of this great information to our viewers.
Thanks for having me.
Our pleasure.